HESI Nursing Exam Prep. Question 1. A nurse is admitting a new client. Which of the following actions should the nurse take while performing medication reconciliation? Compare the client's home medications with the provider's prescriptions. Place the client's home medication bottles in a secure location. Call the pharmacy to determine whether the client's medications are available. Verify the client's name on their identification bracelet with the medication administration record. Explanation: Option A is correct because medication reconciliation involves comparing the client's home medications with the. Question 2. An RNS client with terminal pancreatic cancer asks questions about a do not resuscitate order. Which of the following statements should be included in the RNS teaching to the client? When a heart ceases to beat, the client is pronounced clinically dead. Physicians must write do not resuscitate (DNR) orders. A DNR order can be written after the healthcare provider has discussed it with the client and family. A DNR requires a court decision. Let us analyze each choice in detail to understand why C is correct and the others are not. Question 3. A 26-year-old female with type 1 diabetes develops a sore throat and runny nose after caring for her sick toddler. The patient calls the clinic for advice about her symptoms and a blood glucose level of 210 mg per deciliter despite taking her usual Glargine, Lantus, and Lispro, Humalog, insulin. The nurse advises the patient to use only the Lispro insulin until the symptoms are resolved. Limit calorie intake until the glucose is less than 120 mg per deciliter. Monitor blood glucose every 4 hours and notify the clinic if it continues to rise. Decrease carbohydrate intake until glycosylated hemoglobin is less than 7%. Monitor blood glucose every 4 hours and notify the clinic if it continues to rise.